I'm Lorraine Ballard-Morrill. So many of us have to deal with unsightly varicose veins. We're going to talk to a vascular surgeon and vein specialist, Dr. Charles Dietzek. Let's define spider veins or varicose veins. Are there any distinctions between those two phrases, or are they the same?
When we think of spider veins, we think of those small veins that are at the skin surface. And so those are different than varicose veins, which are below the skin surface and sometimes can bulge through the skin, giving a ropey appearance. These are much larger veins and usually due to more medical issues, whereas spider veins are more of a skin surface cosmetic problem. Spider veins can typically be treated by an office simple procedure in order to eradicate them. This is one of the more common ways is sclerotherapy. Another way is laser therapy. But these are quick office procedures which can remove a lot of the veins in a short period of time. Unfortunately, as we do continue to be on Earth and have gravity affecting our extremities, we will get recurrences. Now, that's one of the big causes for spider veins, which is standing and sitting for long periods of time. But there's also other reasons to have spider veins, and most commonly it's genetics. Some people will have them in their 20s and 30s, but by the time you're in your 60s, about 60% of women will have some degree of spider veins. Varicose veins, on the other hand, are not as common as spider veins, although there are about 30 million people in the United States which have varicose veins. And this is also caused by multiple factors. It can be genetics. Pregnancy is one of the big causes, the hormonal influences and the experience of the pregnancy having pressure in the pelvis. This can result in a lot of pressure on the veins and cause the valves that are inside veins to fail and then subsequently develop varicose veins. The treatments are completely different, whereas with spider veins, we may do, the sclerotherapy, as I mentioned. Typically, with varicose veins, we have to do an ultrasound study to first diagnose which veins are not working properly, and then we can do office procedures to treat the underlying cause for the varicose veins, and then subsequently office procedures to take care of the varicose veins themselves. But this is a little bit more of a complex issue.
Is there a danger, a medical risk to having varicose veins?
Yes, there definitely is. Varicose veins can lead to having a condition known as chronic venous insufficiency, and if left untreated, this can cause a lot of changes to the lower extremity. One can develop skin discoloration, hardness and thickening of the skin, and in the worst cases, you can have actual ulceration and breakdown of the skin. Also, varicose veins can be a cause to develop superficial vein blood clots. This can, in some small percentage, but it can result in deep vein blood clots. So certainly, varicose veins is a medical condition, and one that should be evaluated. And if you're having symptoms or any problems with your varicose veins, this is a condition that is a covered medical issue and can be taken care of with office treatments to eradicate this problem.
Are women more prone to spider veins and varicose veins than men, or are we equally afflicted?
50 to 60% of women at some point in their life will have a vein issue. When it comes to men, it's usually in a 30 to 40% range that men will have some type of a vein problem.
So, Dr. Dietzek, what are the specific treatments that are used to treat spider veins and varicose veins?
Well, with regards to the spider veins, the skin surface veins can be treated typically with sclerotherapy, which is the premier treatment. This is where we inject solutions into the veins in order to eliminate those unsightly small venous channels. Many people in the past have referred to this as saline injections. We no longer use saline in our practice because this causes a lot of burning and irritation and can actually cause problems with the skin itself. There are more modern type solutions which we can inject into the veins. These solutions do not cause any pain or burning sensation at all. And the needles that are utilized are also as fine as a hair. The pain associated with spider vein injection is really quite minimal. As far as varicose veins, there's been dramatic improvements in the treatment for varicose veins and the underlying condition known as venous insufficiency. In the past, people would refer to this type of surgery as vein stripping surgery. People could be laid up for weeks on end with a lot of discomfort following the procedure. Nowadays, we're able to utilize different types of catheters which can be inserted into the veins through needle sticks. The catheter heats up and can actually seal the veins shut, which is then treating the underlying problem as to why they have varicose veins. This is an office procedure which can take 15 to 20 minutes, and you can literally get off the treatment table and go back to doing your work that same day. So this is a dramatic improvement, and there's really no downtime associated with this kind of therapy.
Dr. Dietzek, are there any misconceptions about varicose veins or spider veins?
One of the misconceptions is that there's a simple thing that someone can do in order to avoid them, and unfortunately there's not. The good news is that over the last decade, there have been dramatic improvements in the way we can treat this. Before, where there was surgery, and a lot of people were scared of having surgical procedures to treat their veins, more commonly now we can do office-based procedures in order to eliminate varicose veins and decrease the signs and symptoms associated with them. That's probably one of the biggest myths is that you need to have surgery in order to deal with a varicose vein problem. One of the myths about spider veins is that a lot of people are afraid that spider veins will turn into varicose veins, and that's not the typical situation either. If you have isolated spider veins on the surface of your skin, these are going to remain as spider veins and not become varicose veins.
Dr. Dietzek, I wonder if you could speak to the fact that it seems like a lot of different types of establishments deal with spider veins in particular, and you often see Groupons for these sort of med spas and places like that. You are a vascular surgeon and a vein specialist. I wonder if you can speak to that, whether, why it might be preferable to go to someone who was actually trained in this area.
The important thing is to understand the entire disease spectrum and to understand exactly what one is looking at. Too often, places will look at just the tip of the iceberg and just want to treat what they see without appreciating that there is more problems that are going on. The spectrum of venous disease is broad, and sometimes a person will have little spider veins, but coexistent with that could be varicose veins and other medical issues that are going on. Unfortunately, some institutions or some places will try to approach just one little area without really understanding the big picture. As a vascular surgeon, I'm trained to understand the full dynamics of the arterial and the venous system and to then determine a treatment algorithm that's most appropriate. Sometimes, you get what you pay for, and that's true when it comes to the treatment of vein problems. Unfortunately, I have patients that have come to me that have gone elsewhere, had very poor results, and it's only to understand that the underlying problem was never fully addressed. And so therefore, while they may have gotten a discounted price to have something done to them, it was really that they wasted their money completely because the underlying issue was never addressed. And it also put them at risk for having a kind of therapy performed by somebody other than a vascular specialist and to have an optimum result. I would suggest that when you look at this condition, that do your research, do your homework, and investigate who actually is treating you, and do they have the knowledge and the background to provide you full care of your vein problem.
I mentioned this specifically because I have a personal friend who actually went to one of these locations that had, I guess, spider vein therapy, and she had a very bad experience with it. So it really alerted me to the fact that there are a lot of practitioners out there who are putting up their shingles and telling people that they are able to deal with this and clearly are not. I think that it's obviously very important to really go to someone who truly knows the full length and depth of the issue. Do you have a website?
My website is veinvascular.com. On that website, you can garner a lot of information about venous disease and learn about different vein conditions as well as the types of treatments that we perform. It's a good educational resource. At the same time, we have a blog that you can read a lot of information about venous disease and begin to understand that it's just not a simple treat what you see mentality. It's understanding the full depth of the problem to really design the best treatment program such that we're going to get a good result. One of the myths, I just wanted to jump back for a second, one of the myths that a lot of people have, though, is that if we treat your veins, that you're never going to get any veins in the future. And unfortunately, as long as we're on Earth and there's gravity, and as long as we maintain our genetics, which we always do, the prevalence of getting vein problems in the future is there. And it's only through, proper education and going to a facility that educates the patients appropriately that you're then going to end up with a result that you're satisfied with because you have full disclosure and full understanding of your condition. Unfortunately, some of these places that people go to, they walk in and they expect that something is going to be done. They're told that something is going to be utilized in order to eradicate their veins and never to have another vein again. And so there's a lot of bad information out there. Again, that gets back to your point, making sure that, one does go to someone who specializes in this area.
Well, I want to thank you so much for joining us on the line and giving us all the good information about how to address spider veins and varicose veins. Again, as I say, I think we all have to be very careful about who we trust to deal with this issue, and certainly doing the research that, as you suggest, is very important before you get any of these treatments. Dr. Charles Dietzek, who is a vascular surgeon and vein specialist, thank you so much for joining us today.
Well, thank you as well.
I'm Lorraine Ballard-Morrow.